Okay, everybody. Well, it's 1 o'clock. Thank you all for joining us. I'm Wendy Metcalfe, and I'm the editor-in-chief at Hearst Connecticut Media Group. Just to explain why we're here today, it's for the Road Ahead Life After COVID-19 webinar. I'm going to talk through some formalities before we start getting into the swing of things. I want to first thank our subscribers for joining us. And if you're not a subscriber, we'd love you to check us out. If you go to ct.insider.com, we'd appreciate that. When we are going through today, we have a number of questions that have already been submitted, but we have a forum where you can also enter additional questions that you might have, which will be communicated to me via chat. What we're going to do is mute ourselves amongst the panel. You'll see you don't have volume as a participant, but that is the best mode of communication for us through chat. So the road ahead, as many of you know, you probably saw it in Sunday's editions. It was a forward-thinking look into the innovations, the trends, the obstacles that lie ahead following this global pandemic. And we had about 200 journalists team up with some of the foremost columnists in the state to look at key areas that matter most to you and try to understand, what we've learned through the pandemic, but also how we could be better. And some of those experts are joining us today. And I thank you very much for taking the time for the next hour to take our readers through the questions that they have. I am going to introduce the panelists. We've got Dan Haar, and I'm going to defer to them after I announce them by name to explain a little bit about who they are and what their area of expertise is. We've got James Walker. We've got Mike Lawlor, Johnson McGee, Sousan Arafeh, and Fred McKinney. Thank you all so much for joining us.
Welcome.
And where we're going to go from here is I'm going to give you one question and ask each of you to answer. And from there, we will start going more one by one with questions directed at specific panelists. So if you could open up with your bio and also answer the question of what you think, in keeping with your respective area of expertise, what lies ahead. And let's start with Dan Haar.
Yes, thank you, Wendy, and thank you everyone for being here and doing this, and thank you to the viewers. We can't see you, but I guess you can see us, so we appreciate you being out there. I am Dan Haar, Associate Editor and Columnist at Hearst Connecticut Media, which is all the papers here in our footprint. And I write largely about politics and economics, although some other things. My view going forward, I had a debate with my fellow columnist, Colin McEnroe, in the section, which you may have seen. My view is, broadly speaking, not in any one particular area, that 5 years out, we will not forget the tragedy that has befallen families in this and the difficulty that has befallen the economy, and that is paramount. But we will find ways to make ourselves better as a people, as culture, as a state, as a nation, by looking to what we've learned and moving forward, especially in the economy, for example. We know that there's a lot of inequality of access, inequality of income. There are a lot of inequities across the economy. Maybe in the same way that we come out of the Great Depression in the 30s as a nation of savers and a nation with more social programs, maybe we have a third phase of that. 60s, Great Society, 30s, the New Deal. Maybe we look forward to that, looking back on what we've been through here. That's my optimistic view, and I'm sticking to it, and we'll move forward from there, understanding that there are going to be a lot of bumps in the road.
Absolutely. Thank you, Dan. Let's go to James.
Hi, I'm James Walker. I'm a columnist for Hearst, and I'm the former senior editor of the New Haven Register. I write about social issues and things that bug me, that seem to bug the average everyday person. I'm sorry about that, but that bug the average everyday person. My view going forward is I feel we have to regain trust in our government. I think a lot of us have been let down by what has transpired here over the last couple of months and the mixed signals that many of us have received. So I think for me, the big thing is that I have to gain trust in our system and that our system works for everybody. So that's my look going forward.
Thanks, James. Let's go over to Mike.
Thanks. Good afternoon, everybody. It's a pleasure to be here. My name is Mike Lawlor. I'm an associate professor of criminal justice at the University of New Haven. Been teaching there for since 1995, actually. And during that time, I've been in the legislature, worked for Governor Malloy, and I've always been involved in criminal justice policy. And so what I wrote about in my op-ed is my sense that there's an extraordinary opportunity in front of us, because when this COVID nightmare is over, and we're probably talking about a year or so from now, the criminal justice system will look completely different than it has in the recent past, meaning there'll be a lot fewer crimes being committed, there'll be a lot fewer people being arrested, there will be a lot fewer people incarcerated, and it's actually a real opportunity as the prison system downsizes itself, which it's doing very rapidly. It's down about 1,600 fewer inmates today compared to March 1st alone, like 160 since May 1st, believe it or not. I mean, it's really dropping rapidly. It's going to shrink in size, and the question is, when this is over, will it grow back to its pre-existing form? I don't think it will, but that's dependent, and this is the key issue, dependent on us providing frontline criminal justice people, especially police, with alternatives aside from arrest for cases involving low risk, high needs people. And so I'm happy to talk about that some more.
That's great. Thank you so much for joining us. Let's go to Summer.
Hi, I'm Summer McGee. I'm the Dean of the School of Health Sciences at the University of New Haven. And my area of research and my background is in both public health and health policy. And I've written a great deal about ethical issues as it relates to both healthcare and public health. And so what I've been spending a lot of time thinking about is, how are we going to think differently about our healthcare system and about what it means to be someone who has health information privacy. I think that's something we very much value, but this pandemic has really changed how we think about sharing health information. What do we need to know about each other? The whole premise of contact tracing is that we have to share, to James's point, with our government where we've been and where we've been traveling, and we have to trust that they're going to use that information appropriately when we tell them who we've been in contact with and what we're doing. So I think we really have to change how we think about the health information and the private information that we share. I think we'll be a much more open and transparent society when it comes to health information. And we're going to have to give up a little bit of liberty and freedom, at least for the next few years, until that vaccine is available and we have effective treatments and cures to try to keep this virus at bay. So it's really going to change how we think about some of our most preciously held values in our society: liberty, privacy, and we'll have to take a different approach, at least for the foreseeable future.
Thank you, Summer. And hello to the additional guests who have joined us. We're close to 170 participants on the call, so welcome. And also, just to let you know, if subscribers are joining us, there will be additional coverage online after this, so please join us over there at ctinsider.com. Okay, let's go to Sousan.
Hi, my name is Sousan Arafeh. I'm an associate professor of education, leadership, and policy studies, and the assistant to the Dean of the School of Education at Southern Connecticut State University. And prior to moving back to Connecticut, I was in Washington, D.C., and did quite a bit of consulting for the U.S. Department of Education, as well as I was the Deputy Director of the National Center for Technology Innovation. My area is education, and I've been very interested in sort of keeping the door open for new options and new ways of thinking about how we do education. You know, much of the speculation that we hear about post-pandemic education is really premised on a notion of school as we knew it. And so, you know, there are questions about tests and standards. You know, how are we going to attend school in person? You know, how will we be doing online and face-to-face learning in terms of compensating for what learning has been lost already and what will be lost in the future? And, you know, we're seeing college admissions criteria changing. So there are a lot of things that we're thinking about, but my interest is to ensure that we're thinking more broadly, cross-sector, so that we can try and really address the severe inequity that we have seen with the closing of schools, with students not having access to internet or the materials, the devices to connect with their teachers, with disproportionate burdens on families, some of whom are essential workers and have to work. Students are home alone. There are so many different concerns that we have. And I think that the key with education is that we're seeing that education is really a hub where the economic, where the health, and where you know, all of the other kinds of sectors intersect. And so we need to really address education in a way that is systemic. Italy at the moment is the area that is going back to school as we speak, and so we'll be looking to Italy. But right now, I'd like to encourage us to think outside the box, to be courageous about thinking about new systems, and in particular, to be courageous about thinking about systems altogether in one, you know, altogether in one way.
That's fantastic. I think we need an hour with you alone. I would say that for all of your expertise areas. So last but not least, Fred, please introduce yourself.
Good afternoon. My name is Fred McKinney, and thank all of you for joining us this afternoon to talk about this very important topic. I'm an economist. I'm at the Quinnipiac School of Business, where I'm the Carlton Highsmith Chair for Innovation and Entrepreneurship and the Director of the People's United Bank for Innovation and Entrepreneurship. I've been writing and doing a lot of thinking about how this crisis has impacted small businesses, and in particular minority businesses, but businesses in general. So my column this weekend was looking at where the Connecticut economy is likely to be headed as a result of this crisis, and looking at specific industries where Connecticut has a strong presence, things like defense, healthcare, education, and small business in general, along with the public sector and the nonprofit sector.
That's fantastic. Well, thank you so much. I'm going to switch to some reader questions, and I also have some questions just to lob at you guys from some of the comments you made in your very smart columns that you did in the paper. One of the first, I would say, Mike, and I know James in our conversation yesterday, you had mentioned that you were talking to someone who recently got out of prison, and they mentioned, you know, even though they were in there for some sort of misdemeanor, they didn't expect it to be a life sentence, that their life could literally be at risk given the situation they were in. So that segues to this question that's just come in via chat. We will still need resources for those who are coming out of prison and juvenile detention whenever they come out. How can we form partnerships to make sure they don't fall through the cracks? And I would point that to Mike and you know, James, if you want to add in there after as well.
Well, I'll start. This is a real challenge. This category of policy is usually referred to as reentry. And the good news is here in Connecticut, we have a very robust network of reentry services, mostly carried out by not-for-profits. Bridgeport, for example, New Haven, Hartford, right in Hartford City Hall, the mayor has set up a one-stop shopping office for people directly being released from prison. So it's very important. The nonprofits have really been hit pretty hard, both by budget cuts from the state and federal government and by a drop in voluntary contributions, donations from citizens. And so it's a big challenge for them to keep up. But my focus, you know, reentry is very important, but the truth is there's fewer and fewer people leaving prison because there's fewer and fewer people going into prison, and the prison population is shrinking. To me, the best long-range planning should be focused on no entry. In other words, there are many people who are being arrested, who are ending up spending short periods of time in prison, who really aren't dangerous. They happen to have really high needs, like they're homeless, or they're substance abusers, or they're suffering from mental illness. And in all of those cases, unless they've done something truly dangerous and violent, they can be best addressed in the community by keeping them out of the criminal justice system altogether. You know, as I said in the column, I used to be a prosecutor myself. Prosecutors, police officers, judges, they're not the best people to be making triage medical decisions about how to hook up people with the right kind of support and supervision and services. Now, it's easy to say that. It's harder to actually organize a system to do that. And as the prison population shrinks, in theory at least, that frees up some resources that could be reallocated to the very front end. But it's a big challenge, and I could probably talk for another 2 hours on this exact topic, but I will spare you that at the moment.
I'm sure there's going to be more questions. James, how would you add to that?
Well, the young man I'm talking to, who was just released from prison, first of all, it wasn't a misdemeanor. He had quite a serious charge. However, what he is saying to me is, I'm out now. He says, all I have is a temporary ID that the Department of Corrections has issued me. So if I get stopped by police, because the system is so antiquated, they can't update. So they issue a temporary ID so that if police should stop this young man, it will show that he is legally back on the streets. But he has no job resources. He has no housing. He has nothing. So his question to me is, how am I supposed to make it here when I have this bad background and no help from the state? So when I listen to Mike and former Governor Malloy say that, you know, the prisons have been closed, we're going to use that money to help these young people get back on their feet or whatever, that just doesn't happen. Now, I've also talked to another young man who it did happen for. He got the services that he needed. He is actually back up on his feet. He's actually doing very well. I'm actually going to do a follow-up with him because it's about a year later. So it's kind of hit and miss. And it can't be hit and miss if we want people not to head back to prison. So I think getting those services and getting those resources in place is very important.
Thanks, James. Summer, can we go to you? You had mentioned in your opening about liberties and privacy, and you know, some of the things that Americans most greatly value. And you had discussed in your op-ed piece about the fact that the must-have Christmas present may even be an immunity bracelet. You know, maybe tell us a little bit about that.
Yeah, I think that what we don't know right now is exactly how our scientific knowledge is going to evolve, but I'm cautiously optimistic that we are going to learn that people who are exposed to the coronavirus do develop antibodies, and that there is a somewhat long-lasting immunity that will protect people. That will mean if you have been exposed to COVID-19, you'll be able to go out and interact with people relatively normally, go back to work, resume normal activities. And I think what we will likely see is that that will be a badge of pride. We won't hide that we had a disease the way that we do now. We don't talk openly with our neighbors or our coworkers, oh, I have hypertension, or oh, I have heart disease. But now I see that people are really much more willing to share, because it's about your risk. You say, look, I don't want to go back to work because I have diabetes and I know that I'm in a high risk category. So sharing about your immunity status, sharing about what diseases you may or may not have, that is not normal practice. We Americans tend to be very private about those things. But I think what this virus and this crisis has forced us to do is to be much more willing to share. And as we move forward with our understandings about immunity, and about what's going to protect us and going back out into the world, I think we're going to want to proclaim that, to let people know, one, we're not going to be a contagion spreader, and that we're safe to interact with, and that we don't have disease risk. And so I think that if it really does come to pass, that would be a really big change for people. And I think it would be a good thing. I think we don't need to hide a lot of that information. I think our ability to share with one another our disease risk and our health status, it's something we all have in common. We all have health issues. And so I think that would be a welcome change.
That's interesting, because it segues into some of the questions we got from readers, that we're trying to understand how the changes are going to affect everyday life. For example, I want to take my children to a public swimming pool. I mean, is there a way, how do you get your head around that? What is your thinking in terms of immunity and sharing and privacy? How will it impact the everyday life situations?
Well, I think if we find that our children and ourselves, that we can develop immunity and that it is long lasting, that will be how we go back to school. It will be how we go back to work. And I think it'll be an essential part of that re-entry and reopening process. And so I think that will be something that will very much be part of the conversation. And I think that it is an essential part of what we need to determine scientifically so that we can then make policy around that. Right now, I think the frustrating thing for all of us in all of our respective areas is that we can't make decisions about anything or make recommendations about what should happen next because the science is still so new and so inconclusive. And so, you know, even the guidance around things like wearing masks, a few months ago, we weren't telling people to wear masks. People were recommending against it. Now we're all in on masks. So I think it's something that is evolving. And I think for each one of these areas that we're talking about, whether it's the economy or the criminal justice system or education, we really can't make sound recommendations and decisions about policy until we have the scientific evidence. And so, you know, all of the things and decisions we're making now about reopening are really based off of our best scientific knowledge at this moment, which we all acknowledge is rather limited.
Thank you. Sousan, a couple for you on the teaching front here. The first is from a preschool teacher, and they're asking, is it realistic to assume that nursery schools will open in September? And if they do, what might it look like? They're basically saying that social distancing in such a circumstance isn't possible. Any thoughts on that? And feel free, if there's experts elsewhere in the panel, to interject as well.
Well, I think that Summer hit the nail on the head, which is that we don't have appropriate health information in order to make positive decisions and clear decisions about that kind of thing. Certainly, you know, what we're seeing is that if our parents are going back to work, childcare is well, it's already an issue, but it's going to become a huge issue. And in terms of preschool, the little ones, you know, it's very hard to keep them apart. Part of their best learning is that they have to work and play together. They learn through play. They learn and are socialized with one another. So I am not sure how nursery schools and you know, lower grades are going to go forward. And I think it remains to be seen. I mean, we are speculating that we're going to go back to school and that we're going to have some ways of you know, half classes here, half classes there. Maybe nursery schools, they'll have half of the group go in the morning, half of the group in the evening. But that's all premised on support at home through parents or other caregivers. And I think it's going to be really difficult to know how that should be coordinated.
And Sousan, you mentioned yesterday when we met, do we have the courage to rebuild? Can we talk a little bit about that? And then I'm going to let Dan jump in after, because as you all know, he wrote the utopian view of the way forward. But maybe talk to me a little bit about that. And I might come around to quite a few of our panelists, because I know we had quite an early, you know, colorful conversation around that too.
Mm-hmm. I mean, I don't know whether we will have the courage to rebuild, and I think we all have a different definition of what that might look like, what courage is in our different sectors, what courage is for us individually, or as sort of cultural groups, perhaps. You know, in my mind, the courage to rebuild is to, I think, first and foremost, look at the inequity that we are seeing and that this crisis has really put first and foremost before us. I believe that in all of our sectors, we have not valued people, and certainly people from different cultural groups, certainly people from lower income strata, as many of whom are people of color. And I think also we have immigrant groups, people who are not speaking English, all of whom are incredible resources in our communities, and that I think we could really include them, support them, lift them up, and it would lift all of us up in different ways. But we have to be able to connect with them, get different folks around the table, and really be courageous enough to say, yes, we want you at the table. Now, how do we do that? How do we make our society better with the benefit of all of us? So, I mean, I'll leave it there, but I think that's a big piece of how we need to be courageous in all these sectors.
Thank you. Dan, what would you say?
Yes. Picking up on that, Sousan is talking about the rebuilding of systems. There is the rebuilding of systems and how we do things, and there is the rebuilding of structures and infrastructures. And that's not just roads and bridges, but it's things like daycare, physically. And I think everybody will recall that in 2016, during the election campaign, there was a bipartisan sense that we should have a national infrastructure rebuilding program. Ironically, that was to be about the same size as the $2 to $3 trillion that we're spending now, both fiscally and monetarily combined. I know Fred's going to have something to say about this. My suspicion, again, being the optimist, is I believe we're going to find that because of the state of the global economy and because the U.S. remains very highly productive and a good place to invest, paying back that $3 trillion is not going to be as difficult as we would have imagined. And therefore, the courage to rebuild will extend to infrastructure systems, because we're going to find that we can do more of that without having to worry about it as much as we may have in the past. And to Sousan's point, that extends to rebuilding systems such as health equity and childcare that enable you to move forward in a more equitable way.
So Fred, Dan sort of referred to you there. In your piece, you had looked at, understanding the path to recovery, and that there were key sectors that applied: defense, insurance, education, healthcare, and small business. Do we have the courage to rebuild through those sectors?
I think to Dan's point, first I want to address that you have two economists on the line. It's almost impossible to have two economists on the same call. I tend to be a little pessimistic on the short run.
That's great for balance.
I'm optimistic on the long run, but in the short run, I think we're in for some difficulties from the economic perspective. I do think that we're showing a willingness. If you can call it courage, you can call it you got your back against the wall. We're instituting policies that typically would not be done in the speed with which it's been done at both the federal level and the state level. I mean, we are spending tons of money, and some of that spending is not as well thought out as it should be. And so I do think that there's clearly a willingness. I don't know if I would characterize it as courage, but I do think that the American people are courageous and have shown that courage in their behavior, with the overwhelming majority of Americans realizing, one, there is no vaccine right now, there is no cure right now, and until there is a vaccine or a cure, you're still at risk. Nothing has changed. And so as a result, the only thing that seems to work is to distance ourselves. That is not conducive to sort of a return to what you might call normalcy. So I think the real issue, and I raised this in another piece that I wrote, was normalcy is not good enough for me. I don't want to go back to just normalcy. I think, as was said earlier, this is an opportunity, perhaps a once in a lifetime opportunity, for us to rethink what are the relationships that are most important in our society. Well, how should they be structured? And this, as was also said, this is revealing the weaknesses in society, and it's also revealing with this concept of essential. Who is essential? And it turns out that essential is the grocery clerk. It's we knew about police and fire, but it's people who are low-wage workers. It's the farm worker. It's the meat packer. These are not fancy jobs, and it's forcing us to understand who's important and who's maybe not as important. Everybody's important, but essential is got a whole different meaning now because of this crisis.
And I think that piggybacks on what Sousan was saying, and that is finding value in people at all levels. 3 months ago, the grocery store worker, we could care less about. And suddenly they became the most important people on this planet because without them, we can't eat. And yet, these are the same people that are constantly put on picket lines to demand more money. They can't get full-time work. They have to work 10 hours one week, 20 hours the next week. We put very little value there. And now we're finding that there's a lot of value there, and we're beginning to recognize that, and we should continue to recognize that when this crisis is over. They,
No,
that-
I'm reminded of, I was listening to a speech recently that Martin Luther King gave. It was really his last speech in Memphis in 1968. And if you remember, he was in Memphis for a garbage worker strike.
that's correct.
And one of the main points in that speech was the value of these workers that hardly anybody values. And they were largely Black workers in Memphis. And you think about it, we really don't think about how valuable things are until we lose them. And you know, we've lost a lot in this crisis. And so there's an opportunity here for society to refocus, to say, okay, this market system, and I'm, as an economist, I'm for market systems, but our market system has serious flaws when it comes to making distinctions in what people bring to society. And I think we've got to review these flaws. I mean, the child care worker is an incredibly important worker, but we don't value that worker in economic terms. So this is an opportunity to sort of rethink society's priorities.
And I would just add, from the perspective of healthcare, what I've been surprised by is that we haven't had calls already for universal healthcare reform, right? The broad way in which we've seen that health disparities have disproportionately impacted communities of color because of COVID-19, right? That these things should just no longer be acceptable. And the fact that we can't even coordinate getting supplies and PPE to hospitals nationwide, right? And so I actually wrote in another op-ed for another paper about how I think as this crisis hopefully begins to wane very soon, that I expect we'll see calls for significant health reform, because I think this has really shown a bright light. And I hope we have the courage to finally take that issue head on as well, because we really need to see some dramatic change in our healthcare system and to address health disparities as well.
Well, the move that we've had in the COVID-19 response is it not, Summer, a move toward one step toward universal coverage? Isn't that a step?
It was a very small step. I mean, guaranteeing access to care and coverage for people who have COVID-19, regardless of insurance status, I think was a move in that direction. And we did see some greater federal coordination, moves to cover telemedicine and telepsychiatry and things that we previously resisted doing. I think we did make some important steps forward, but where we had steps forward, it was done with the federal government taking the lead and saying, we're going to control this. And so if we had that at a national level on things like PPE purchases and supply chain issues, I think we'd be in a very different place in some parts of the country right now. So I think it's shown that we do need a national level healthcare system of some kind. And so I won't go into a whole healthcare reform debate. That's a different panel we can have another time. But I do think it really has shown a light on that what the federal government can help to do, and that we do need for certain things like huge healthcare crises like this, we need federal level coordination.
So we have a ton of questions coming in. I'm going to try and rapid fire through these and direct them, but again, feel free to interject. Fred, I think this is a question for you to begin with. How should cities reorder their priorities to deal with a loss of tax revenues?
Whoa.
Wow, that's a big one. We all live someplace, and I happen to live in Trumbull, Connecticut, and our first select woman has been doing robocalls, automatic calls 2 or 3 times a week, informing us as citizens of this town what the state of the fiscal budget is in Trumbull, and I'm sure that others around the state are seeing similar things. This is a crisis that is really, because of it's affecting revenues from the perspective of the public sector, but it's also affecting costs. So their revenues are shrinking and their costs are increasing, and that's a formula for disaster. You know, in Washington, there's a lot of talk about the next round of the intervention to focus on the fiscal needs of states and localities, and it is a huge problem. I mean, localities they raise most of their money through property taxes, and those property tax owners are homeowners and business owners who own property who either can't work right now because of shelter in place, or their businesses are closed right now. And so there's no money to pay taxes. And that's many of the municipalities have taken the proactive step of suspending those tax payments for the foreseeable future, which I think is wise. But I do think that can be temporary, but there will be a hangover for this. And the municipalities will need help to close some budget gaps. Unlike the federal government, state governments and local governments cannot run deficits. They've got to balance their budgets. So that means that the difference here has to come from borrowing. It's going to be tough, I think, for many municipalities. In my article, I pointed out that this is an opportunity to correct some of the inefficiencies in how Connecticut is structured. We have 169 towns, 168 towns in this state, and we're a very small state geographically. And that town government is inefficient when you think about it. And so I think part of the courage that I think really needs to happen is this has been talked about for years in this state about regionalization. We've got to look at better ways of organizing the public sector in this state. There's no need to have 150 fire departments, 150 police departments. This should be coordinated in a way, and that would save all taxpayers some money. So I hope that we take this as an opportunity. No good crisis should go unused. This is a crisis that we should use to make some changes.
So Mike, what would you say of the prison system? We had an earlier question submitted just saying what type of change do you foresee in the prison system? And one of our participants has also chatted to say how might it be reconfigured to ensure the health of the prisoners moving forward?
Well, I mean, the footprint's going to be a lot smaller. If the current trend continues to be, we've already lost about 1,600 total population in our prisons. It's probably going to go down at least another couple of thousand as we get into the summer. That raises the possibility of closing down facilities altogether. But I think during the course of the COVID crisis, it's so important to keep, to the extent possible, social distancing within correctional facilities. So my sense is they will keep them open. They'll just be more sparsely populated. And then once the crisis is passed, then you'll see some of the fair number of facilities close. The good news is that they anticipate a large number of retirements among Department of Correction employees over the next year or so. People may not realize this, but the Department of Corrections is by far the biggest state agency by number of employees. There's just under 6,000 people who are employed by the Department of Correction. And the next biggest are the Department of Transportation and Department of Children and Families, and they're about half that size. So just give you an idea of the size of this. And so fortuitously, the state anticipates a lot of retirements over the next year. So the footprint will definitely get smaller. My hope is that we'll continue the process of changing the way we actually run our correctional facilities. There's a lot of models out there, in particular in Europe, where the facilities are very, I've toured prisons in Germany and elsewhere, and other folks have. It's so completely different than the way we run our prisons. It's much safer. The recidivism rate is much lower, and it's much, I guess you could say, more humane. The people who work there like it better. They're more motivated and a lot more satisfaction. So this is an opportunity to reboot the whole thing, including the prison system. I think that's going to happen. But again, I just want to stress what's really going to drive this is the very front end, the entry level. We know before COVID, the number of young people being arrested and coming into prison was dropping steadily every single year. So for example, among 18-year-olds, there are 70% fewer 18-year-olds got arrested last year compared to 2009. So that's a huge change over 10 years. Same for 19, 20, 21, 22 years old, just a huge change. So the prison population is getting a lot older. The ones who remain behind are the ones doing these long sentences. That will be a big challenge. And my guess is you will see on both the front end and the back end a lot of change taking place.
I just want to really quickly point out that under Mike Lawlor as the chief criminal justice policy advisor during the Malloy administration, the costs already did go down by almost $1 billion a year. So he's not going to give himself that credit, but I will. And so it's a long process.
So clearly a need for a lot of change moving forward. James, you wrote about the disappointment that you felt through the pandemic when looking at, government and common sense decision making. Can you tell us a little bit about whether you feel we can do better in Connecticut?
Yeah, I think we can do an awful lot better, particularly when we come to the criminal justice system. I think we need to revamp this bail policy that we have. We have people in there with the bail is so high that they're in pretrial. Yet the bail is so high that they're stuck in prison over, and my understanding, I don't know this for a fact, I know what I'm being told, over misdemeanors. And it just doesn't make sense to me. So I definitely think that is something we can do. I think we need to take a hard look at where we put toxic plants, chemical plants and so forth. They're crowded into low-income, poor areas. Asthma is very high there. That's one of the problems with COVID-19, is that it affected people who had asthma. We have housing situations where we have lead and so forth that is really harming young children. I think we need to take another look at this. Again, I think this whole thing about if you have no money, then what happens to you isn't important. And I think that COVID-19 has exposed that income has nothing to do with it. We are all valued and we all have a place here. And I think that we need to take a look at some of these things, such as bail, housing, for low-income people, to give low-income people a hand up, and we just don't do that.
If I can add on, I'd like to, there's the school to prison pipeline as well. And one of the things that I think the reason that happens is that there are students who are getting involved in all kinds of disciplinary actions, and it's because in many cases they're having trouble in their communities. Maybe they don't have food. It's not only lower income kids, again, who are disproportionately children of color, but in many cases that's what happens, in addition to sort of the implicit biases of school staff who would target, say, a black child versus a white child in terms of discipline more and more severely. So, I guess my point would be that we also need to rethink how that takes place in school, and what are we doing to safeguard our children, again, systemically, when in terms of economic situation they're having trouble, and then in school, the way that the school exacerbates that, and then in many cases it moves into prison. So we need to pay attention to that.
And we need to look outside.
Go ahead, James, and then I'm going to go back to Sousan with one.
Okay, I think we also just need to look outside the box when we think about things, and we need to stop revisiting old policies and old things that we attempted in the past that didn't work in the past, and I don't know why we feel they're going to work in the future, such as a curfew. The curfew in Bridgeport for people under 18 years old. Number one, how do you determine that a 16-year-old or an 18, how do you determine that? You can be 18 years old, legally able to walk down the street, and yet if you have a curfew in place, you're stopped by the police. I just think we go back to this old, revamping this old stuff that doesn't work. We need to think outside the box and find ways to make our problems disappear forever, rather than just retreading this old stuff that does not work and has proven time and time again that it does not work. In fact, it's detrimental to a lot of people. So I think we just need to really start thinking outside the box and stop going back to these things we know don't work, but they sound good, when we're in a crisis.
There's a real theme emerging here, thinking outside of the box. And this one, Sousan, is coming through chat, and it's from a very optimistic secondary school math teacher, which I love. During this time, the inequity in public education has been brought to the forefront in a spotlight. Moving forward in public education, how can we ensure that reform and reimagined education are truly tailored to the vast needs of districts and not forced Band-Aid approaches while balancing the academic and social emotional needs or not only the students, but the teachers, the administrators, and so on?
It's a very big question.
It is a big question.
First, let me say just a huge shout out to our teachers and administrators, the staff of all kinds, student support staff, because they have done just a phenomenal job turning the ship around within a matter of weeks, literally. And so I think it's important to give them credit for that and to understand the incredible stress that they are under now and that they've been under for some time. I would say starting with No Child Left Behind in particular, and that level of school reform where, you know, we are doing increasing standards, more accountability, teacher evaluation being tied to student achievement, all of which are metrics that can be useful, but that don't measure the entire child or the entire system in ways that are holistic. And, you know, again, I think like you said, James, you know, we're kind of focused on the same policies that we know are not working for us. So there's that. Then I think there's a portion of this that has to do with short-term and long-term, right? We're talking about thinking out of the box. We're talking about going cross-sector in terms of the way we're planning, strategically planning as a state and as you know, again, you know, our 160 plus districts. There has to be a short-term triage approach to, you know, how do we educate our kids immediately? How do we keep everybody safe and sane? And then there has to be this longer term real effort to change the way we do things elementally. And then in terms of, you know, I think I've lost part of the question, but in terms of the optimism, you know, how do we keep everyone safe and sane? How will we change the system? I think it's really important to think about who is at the table. And I think it's also really important to think about what kind of research-based information are we actually getting that is useful for us. And I would argue that, you know, many of the kind of survey-based information is useful in some way. We can, you know, there are hard numbers and we can see those numbers, but much of the change that needs to occur, I would argue, is much more relational, is much more interior, and I think we have to think about how are we getting information about that. Also, again, who are we getting the information from? How do we get information from more people who are involved in the system? And, you know, Fred, you had talked about how important our, you know, our early childhood educators are and all of these essential personnel, et cetera. I mean, we have to think about, you know, those are the people that we need to rely on. We should pay them well. We should value them. We should give them professionalism in their professions. And I think that's very true in education. So I think I've answered most or some of them.
Thank you. And it's lovely to have teachers joining us as well. And I'm going to go straight over to HIPAA laws now. So Summer, wondering from a reader, basically, does HIPAA, you know, do the HIPAA laws overrule their need to know if roommates in a senior living facility have died from COVID-19?
Yeah, so obviously nursing homes have had the spotlight put on them in the last few weeks, as here in Connecticut, you know, upwards of 80 to 90% of the deaths in any given week have been happening in nursing homes. And so obviously family members who have loved ones in nursing home and long-term care facilities, they want to know. And I think that there is a provision in public health law that says that HIPAA laws can be overridden and individual patient privacy can be overridden, but only to the least restrictive way possible. So basically, if we don't have to identify the actual individual in the paper, we can talk about which nursing home it is. We can talk about how many cases there are. But I think what's more important than knowing the actual person's name is knowing that there are positive cases in the nursing home. So I think there are limits on HIPAA, and I do think that those are important. We don't want people to be singled out or targeted. as someone who's carrying a virus. But we do have a right as a public to know where cases are and where there is risk. And so that's the balancing act between the HIPAA privacy laws on the one hand and the interests of public health. So I think it's completely appropriate. And what I've been hearing from nursing homes in the state is when family members of residents call, they have a right to ask, are there any positive cases of COVID-19 in the facility at this time? And they have to answer and say whether there are or there are not, and to disclose that. So, and then you can determine what risk level you're willing to tolerate for your loved one or family member, and decide what you want to do about that. So I do think that that level of transparency and disclosure is really, really important. But despite what I said earlier about, we're going to have to be willing to share, that sharing and relinquishment of privacy is not absolute. I think people do still have a right to share, to not share certain information, and certainly nursing homes and other organizations should not be doing that on patients' behalf. That sharing has to come from the individual. But that is, I think, something now the federal government has taken a position on this and are now requiring level of transparency and reporting of cases. And I think that's a very good thing. So family members can make decisions about whether their loved ones should stay in those facilities or to make alternative arrangements, or at least to be monitoring for that risk.
Okay, I'm sure that will prove to be very helpful advice for the person who was asking that question. Fred, we've got one for you. Do you anticipate accelerated political interest in establishing a basic national income?
Fred, you're mute.
Sorry.
I'm sure it was really interesting though.
Yeah, I've got my two dogs here sitting beside me, and they were getting active, and I didn't want them to be barking on the call. They've gone upstairs, so I'm okay. No, I think that the key number here is that yet this morning it was announced that there were an additional 3+ million people who filed for unemployment insurance. And that brings the total to 33.5 million Americans who are now on unemployment insurance over the past 7 weeks. There has never in our economic history been an amount of workers, American workers, in such a short period of time been unemployed. And this is, again, is different from every previous economic crisis that we've had. And what we've done as a government is we have stepped in and used our unemployment insurance to essentially supplement the incomes of these workers. And so not only is there sort of state unemployment, but you have the federal government kicking in $600 a week for those unemployed workers. So now you got workers who now have some income, and in some cases, some workers will actually have more income with the enhanced unemployment than they did when they were working. And so people are getting a taste for what it might look like to have a basic economic floor underneath them. And I think that there will be some political interest in exploring what one of the Democratic candidates, Andrew Yang was talking about during his campaign of a universal basic income. I can't tell you whether or not there's going to be any large movement in the Senate or in Congress for this. I don't see it coming out of this White House. But next year, the election might. I think this is going to be an issue. And it will be an issue this year in the election, but I wouldn't try to handicap it. But I do think that people now are aware that this relationship between your ability to pay your bills and live with dignity need not be tied to your employment status. I mean, we assume things because that's the way it's always been, but it doesn't have to be that way.
Yeah.
So on that note, that's interesting. And James, you might want to start by answering this one, and I might ask Dan to chip in. And we've got 5 minutes left. But with our government in gridlock and hyper-partisanship worse than ever, how can we expect the two parties to move us out of this economic mess that we are in? Without a new mindset of bipartisanship, I don't see the problem solving to any degree we will need. That's just come in from a reader.
Well, unfortunately, I agree with the reader. It's, we're in a situation here where it's you're a Republican or you're a Democrat. Nobody's a human being anymore. You follow a party's philosophy, and I just find it just ridiculous. I'm not sure why I, as a person, can't have some Republican views and can't have some Democratic views. The point is to make life better for everyone. And to me, everything is what the party wants you to do. And some of the things that are happening just don't make sense. There just doesn't seem to be a lot of common sense going on here. I talked earlier about universal basic income, because I believe it's really coming in some form, because it's real clear to me. We have hourly workers who are begging for $15 an hour, and yet a family pack of the cheapest chopped meat you can buy is $15 an hour. There's something wrong with that. You have, a 2-bedroom apartment here in Connecticut will run you $1,500 a month. You have a $15 an hour income. Things are just out of whack. I mean, that's all. So that's why I believe that there is a universal basic income coming in some form. We can't lower prices. They can only continue to go up. So, what can we do here? So I agree with them. I think it's gridlock, and I think whoever comes across with the message that makes Americans feel like they can have the American dream again, I don't care if it's Republican or Democrat, that is who people are going to vote for.
So Dan, I'm going to defer to you to answer if it's gridlock, but maybe I thought it would be interesting for the participants as well, as one of the frontline workers, being a columnist who's been out and about covering this crisis, maybe as we wrap up here, give people an insight into what it's been like to be a journalist at this time.
Well, I certainly have been out and about. I would say I see my role and our role as journalists as being separate from the sort of frontline workers, because even though we're out there documenting it, and I still do see that sort of separation. When the signs say thank you, I asked a friend of mine, I said, when they say thank you to the frontline workers, are we included in that? And she said, no, not us. So there is still that separation. And however, it's an obligation that we take seriously and a privilege to be able to do that. I just quickly want to point out that the $1,200 checks that went to most Americans were part of the move, a slight move, to Summer's point of slight moves, toward universal basic income. I do not think that we're in a permanent gridlock. I think that, in true to the sort of optimistic view of things, I think inevitably politically, and I see Bob Lyon is on the call, and I hope he agrees with me from Stanford, that we will move toward the center, as you've already seen the administration and Congress moving together on the remediation efforts here. That is in itself a move to the center. And to the extent that the economic crisis continues, that's what's going to have to happen. But as a journalist, I feel privileged to be able to do it, but a little bit separate from the front line.
Thanks, Dan. And folks, we're going to be wrapping up in a couple of minutes. First of all, I would really like to thank everybody who attended today. We had more than 300 people sign up for today, and at various times we've had about 175 people active at one time. So we're immensely grateful for that, and thank you to all of you as columnists. I will say that I observed this theme of thinking outside of the box, and it correlates to something that was said in The Road Ahead very adeptly by the sister of someone who lost their lives during COVID. And it was this desire to be better. And she had said, we need to be better. And I think that's something that this panel will agree that, there's been learnings, there have been problems that have been greatly exposed during the crisis, and this desire to be better and to think of, robust solutions to catapult us forward, but also to make sure this doesn't happen again we don't want to be back in this situation ever again. I know we're all in agreement on that. So for now, unless there is any closing comments from any of you, I'd like to thank you, and until next time.
Thank you very much. I appreciate it. I appreciate being here and listening to what my colleagues have to say about what's going on.
That's great. Well, thank you all very much. And thank you to the participants. We'll see you next time.
Thank you.
Thank you.
Thank you.
Bye. Thank you.
All right.